Thank you, sir. It's a pleasure to come on the Clirnet platform. And today's topic is in the news. So, we'll be discussing the natural history of Nipah virus, when it was identified first, and how much harm it has caused over the 3 decades, and the epidemiology, the current situation, and prevention control, and some concerning facts also, that whether it can trigger a pandemic in its natural ecology, or if it is tampered with by gain of function research. So that concern is definitely there. We'll be touching on that also. So this is the scope of the session: origins, epidemiology, morbidity and mortality. It has got a high mortality. Morbidity is also severe. It causes brain infection, it causes respiratory infection, and pandemic potential is, we will see the data and question it, though it has been labeled as a potential organism infection which can cause pandemic, but we have to critically appraise it. Clinical manifestation management, and then lab hazard, we would be talking about it because there are certain concerning news about 5 years ago about some lab work going on in an Indian lab, and that to a private lab without the knowledge of the government of India. So we'll be touching on that. Then research in vaccine, whether it should be a priority, we will see, because based on epidemiology, we have to plan the public health. So we will see the data first, and then we will see that who all should be vaccinated, or will we require mass production and roll out on a large scale, or it has to be only focused. So this is the Nipah virus is a bat-borne pathogen. The fruit bats, also called as flying foxes, Pteropus bats, and the virus comes in the family of Paramyxoviridae, genus Henipavirus, which also contains the hantavirus, which affects the rodents. That is also very rare infection, but can be severe. Bats are the natural reservoir, but it can pass on to other animals like pigs and horses, as it happened in past outbreaks in different countries. Then it can cause severe neurological and respiratory disease. So this is the history of Nipah virus. It was first identified. Actually, it was identified. We don't know. It may be there since ages. In 1998, in Malaysia, and the Malaysian outbreak was transmitted to humans from pigs, infected pigs, who ate the fruits contaminated by bats. And since then, it was identified in 1998. There have been outbreaks in parts of South and Southeast Asia. There have been outbreaks in Bangladesh, there have been outbreaks in Philippines and India. Is considered to have pandemic potential by the WHO. This requires critical appraisal. We will discuss about it. It is zoonotic as well as person-to-person transmission, latter from very intimate contact. Even in the present West Bengal, 2 cases have been identified, 2 healthcare workers, and 197 intimate contacts have been found negative. So that only conveys that it has to be by exchange of body fluids and very intimate contact and very unhygienic, overcrowded conditions perhaps. That's why outbreaks occur in poor people, poor socioeconomic strata. So these are the timeline. Malaysia, first it is named after a Nipah river village in Malaysia, where it was first identified in 1998. 283 cases and 109 deaths, which gave a case fatality rate of 39%. Then from Malaysia, it had spread to Singapore in the same period because of the export of pork, which was infected. The pork handlers, 11 cases in Singapore, only 1 death, so 9% fatality in Singapore. Then no evidence of human-to-human transmission in these outbreaks. In Malaysia and Singapore, there were no human-to-human transmission. Bangladesh is having a repeated problem since 2001, seasonal outbreak in winter. It is related to that sap date 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 harvesting for this date palm sap. They and the bats are also attracted to these dates and the contaminated date palm juice, which carries the virus. Those people who work with date palm, they when they drink the raw, they are exposed. Once the date palm is heated, there is no danger. To date in Bangladesh, since 2001, there have been 348 Nipah virus disease cases with 250 deaths, corresponding to an case fatality rate of 72%. And recently, 2026, I think a week or two ago, there have been one death in Bangladesh. So it is coming down because as people are getting aware, the villagers are also getting aware. Once we see the trend, the deaths are coming down because simple precautions not to eat the raw fruit, not to go near this dropped fruits which have been contaminated by the saliva of the fruit bats, the flying foxes. And so these simple measures and wearing gloves and all those who handle or and be careful of the raw sap of this date palm. So these can prevent the infections from fruit bat to humans also. Philippines, there were 15 cases in 2014. Case fatality rate was 82%. And Philippines, the transmission to humans were from infected horses. So there are three basically identified. Initially pigs in Malaysia, then fruit bats in Bangladesh and India, and then horses in Philippines. So these are India. India figures are first 2001 there were 66 cases, 45 deaths. In 2007, West Bengal 5 cases, 5 deaths, so almost 100%. 2018, recent one, Kerala 18 cases, 17 deaths. Kerala, single case was reported who survived. You see, survival is also increasing now. 2021, 12 or 75 in one case only. 2023, 6 confirmed cases resulting in 2 deaths. Then 2024, 2 confirmed cases, both died. And 2025, at least 4 confirmed cases were reported, no deaths. And the latest is West Bengal, 2 cases, no deaths so far, fortunately, but one was serious, but still we don't have the report on that. One has recovered, one was in ICU. And 197 close contacts of these cases were tested and all were negative. So that gives that the transmission is not very effective. Human to human transmission is not very effective. Therefore, the pandemic potential remains low because it can be almost considered as an occupational hazard. Those occupation is to make this the khejur gur, they make that jaggery from that date palm. So they have to be educated to wear protective gloves and all, not to not to drink that date palm, raw date palm, and be careful. And the human to human transmission is almost negligible, but the 2 health workers in a private hospital, they got infected because the hospital infection practices also requires care, and overcrowded Indian hospitals we know. So some education and basic infection control practices can prevent. And because it is has severe symptoms, CNS symptoms, respiratory symptoms, high mortality, the secondary attack rate is almost minimal because the person gets isolated. Once the person gets seriously ill, gets isolated, so it doesn't transmit. So those viruses which cause milder disease have got pandemic potential. So this is almost a self-adaptive mechanism. Unfortunate those people who contracted, for them it is a unfortunate thing, but for the community the risk is very low. So therefore it doesn't have a pandemic potential as of today, provided that it is not tampered with in the lab, which is a possibility considering the recent developments. So we'll come to that. So these are the Indian graph. Initially, you see 2018, the number of cases were also high, and then the deaths was also high, and now the cases are coming down. And here 2023, blue is the cases, and still the survival is increasing from here to, and the cases are also coming down. So you see, it is disappearing rather than emerging. So if you just study the hard data, you should be reassured that the risk is, because as I said initially, everybody was caught on the wrong foot. Didn't know how fatal it is in Malaysia, in Singapore, in Bangladesh. Now in India, at least we are people may be educated that everybody, the media is also there, that fruit bats are there, the date palm sap. One has to be careful not to be pick up the fruits fallen on the ground in those infested area. So cases and deaths are coming down in India. So these are the total cases and deaths. So this is the actual thing in Bangladesh and West Bengal. So this is the date palm sap and these are the fruit bats. It hangs upside down and they collect it in this vessels, mud pots, big pots, and it is raw sap is collected, and sometimes the villagers, if they, unfortunately they drink contaminated with this bad saliva, they are at very high risk. So if they are educated, and then there are various methods, sometimes they put some bamboo covering so that the bat do not get access to this. So there are different methods have been tried. So this is the actual, as I said, one can consider it an occupational hazard. The general population is hardly exposed to the virus, and the person to person transmission is also not very effective. Droplets are there, saliva is infected, but until unless you are very close, very intimate, the spread is minimum person to person. So therefore, it does not have a pandemic potential as on today. So this is the diagrammatic, the past outbreaks in the Southeast Asia region. So this is the blue one is the cycle in Malaysia 1998. So these were the fruits which dropped to the ground, eaten by pigs, and the pigs are handled by men because the pork industry is very congested pig industry in Malaysia. So handled by humans, they got infected. So initial about more than 200 cases occurred, and then of course there have been no outbreaks because once they knew the risk, they knew the epidemiology, precautionary measures have not reported any further. So this was the bad fruits, pigs, and this was the Malaysian outbreak. Here, what is this we see here? This is the people consume contaminated date palm. This is the Indian, Bangladesh and India. So this is the collected the palm and the raw. If they drink, they can get sick. People infected through close contact with unwell persons and the secretions are also vulnerable. So that's why close contacts one has to be very careful and normal personal hygiene. So these are the main pigs, and this is the fruit bats. Then if fruit bat, then fruits and pig and human. Now this is the unique thing in Philippines. People infected following contact with unwell horses or handling consumption of horse meat. So these horses also pick up fruits from the ground. So these, you have to be careful of those animals who feed on these fruits or go to areas which is infested by fruit bats. So people infected, so these are the three different methods in the three different parts of Southeast Asia. And these are the regions. Actually, in epidemiology, you have to consider the ecological factors. So the main reservoir is the fruit bats. So these are the regions where fruit bats are present. As part of as part of Australia, because Australia, all developed countries, their hygiene is good, their socioeconomic status is good, and then the Southeast Asia region and India. So these are the places where the fruit bats, and from these places only the cases have been identified. And another, as I said, there is a concern that hazardous. See, if you see, the risk is very focused. Those who are exposed to the fruit bats in the forest or who are working with this sap, date palm sap, and once they are educated, the risk come down. Unfortunately, there is lot of biohazards and lot of clandestine, I would say, work going on in labs around the world. And unfortunately, this was also found in India during the pandemic only. Once there were pandemic was going on, there was a Nipah virus research and handling of Nipah virus by a private laboratory in South India. And the work was being funded, Nipah virus research was being funded by American government, CDC, Center for Disease Control, without the knowledge of the Indian government, bypassing the Foreign Currency Regulation Act also. Any funding from a different country has to come through Ministry of Home Affairs and Ministry of Health, and through FCRA, Foreign Currency Regulatory Act, bypassing that. So it almost amounts to clandestine research, and this was reported in the Hindustan Times. So this is unfortunate. Some scientists may be tempted to do research like this, getting huge grants from foreign governments, but this is not in the interest of humanity, because this lab was not having the facility to handle the Nipah virus. Nipah virus have been identified as a grade 4 risk, highest risk virus, as a lethal virus, dangerous virus, hazardous virus, and this lab had only facilities up to BSL-2. So they were handling this without the knowledge of the Indian government, and the Indian government tells the US Health Agency to stop this research. CDC America's frontline public health agency has partnered with Manipal Center for Virus Research to carry out illness surveillance across India. So they were working on the Nipah virus. Hindustan Times, February 7, 2020. It is available on the net. Though, of course, Government of India had told them, designated this lab for Nipah virus, but it has not permitted to carry out research with a foreign country without the knowledge. So this is something very serious. India has asked US to stop funding research without government approval after the agency appeared to have helped an underqualified Indian laboratory to work on the Nipah virus, a pathogen that is considered a potential bioweapon, according to officials and government documents assessed by Hindustan Times. So that's the concern, because this past SARS-CoV-2 also, now the finger of suspicion points to the lab rather than from the jungle. So Nipah also from the jungle, it is not spreading, it is not catching fire. Since 30 years, there have been just about 450 deaths in 30 years from Nipah virus all over the world, and more than 500 people die on Indian roads from road traffic accidents. So where is the bigger danger? Of course, any death is unfortunate, but if you see the statistics, the motor vehicle and two-wheelers are more to be feared than the Nipah virus if the number of deaths are taken into count. 500 deaths every day on Indian roads daily, and less than 100 in 3 decades in India, and less than 500 all over the world from Nipah virus. So which is the bigger here? So this Manipal Center for Viral Research carried out tests on Nipah virus, of which there was an outbreak in Kerala, said one of the government officials cited above, asking not to be named. So though it was designated by the government, but it wasn't given any sanction to collaborate with any foreign country without the knowledge of the Indian government. And they were carrying out more detailed studies on the virus, which was not forget about approval, which was not in the knowledge of the government of India. And one of the conditions was, if the vaccine they prepared, the CDC, the patent will not be with the Indian researchers but with the CDC. So this is something which has come to light. So the concern is there may be so many other clandestine research going on all over the world, carried out by foreign agencies. So there should be a proper inquiry on this, and all scientists, all researchers should be very aware that they may start the work innocently thinking they are doing research, but it is not in the interest. The government has asked both agencies to stop the project and track mystery for. It has also asked CDC to comply with Indian rules, but it should be accountable. It should be a deterrence, because this is a very dangerous research they were doing it. So anyway, this is something I thought I would put on record, because this is highly irregular. This is highly irregular. So clinical features, of course, 99% get fever, headache in 70%, disorientation 65%, respiratory symptoms, brain involvement in 71%, and in the people who recover also may have some neurological long-term effects. Median case fatality rate is 31% to 88%, and as you see from the graphs, it is coming down because people are becoming more aware. They are getting, and the management is supportive intensive care management, IV fluids and other things. They have been off the self, say off level use of remdesivir and other things, but we know those things do not work. They tried it out in COVID also, remdesivir it had. So they have been, but if you see the actual public health burden of Nipah is not that. You have to be careful. It can be easily prevented. So prevention and control is awareness among the locals not to eat fruit or raw date palm juice contaminated by fruit bats, personal hygiene, and probably that's why the secondary attack rate was zero in West Bengal. 2 cases, 197 contact, no one found because people have become more aware of personal hygiene. Protective equipment for those working with date palms and occupational groups who come in contact with fruit bats or their contaminants. So focused protection. Then vaccine work is going on, and the Coalition for Epidemic Preparedness and Innovation establishing world's largest Nipah virus vaccine in collaboration with Serum Institute, Pune, India. Phase 2 trials in progress. The question is who will get the vaccine and why so many large doses is required, or only those who are going to the forest working there. So we have to take a call on that. So as per the data, not indicating the general population but only high risk group if at all. The only concern is if they do a gain of function research and it create large number of cases which are mild and but more transmissible. In infectious disease, mild cases are transmitted more widely because people are asymptomatic, they pass it on. Those who are serious, they get isolated. So the gain of function research, one has to be careful. One has to be That's why this research which was going on in Manipal Institute should be taken very seriously. Pandemic potential is high mortality and low community transmission. With R naught below 1 does not make it a potential candidate to trigger pandemics. Road traffic accidents kill over 500 in India, while Nipah has killed less than 500 in 3 decades globally since its discovery. Situation can change if it is subjected to gain of function research in the lab to increase its transmissibility. So here is the concern because America scientists are very adventurous. In fact, the Wuhan lab also, their evidence points to the gain of function research which originated in University of Chapel Hill by one Dr. Ralph Barrick, whose co-worker was working in Singapore and Wuhan, and they were trying to infect back with a very mild virus, coronavirus, and it got leaked from Wuhan. That is one of the, and it was a DARPA project, that is the American Defense Forces project of American Defense Forces. So, and therefore it is of greater concern the CDC America was conducting research on the Nipah virus with the Indian private lab unknown to the Indian government. So it should be properly investigated, and so that checks should be put in place so that this is not repeated. These are dangerous, hazardous. Future pandemics may emerge from the lab instead of the forest if ban is not put on gain of function research. Gain of function research is they tweak the virus in the lab to make it more transmissible. So this can be a dangerous thing. So this is what one has to keep in mind. In the nature, it has existed for 3 decades or perhaps more. It is only identified. There are so many viruses which can be identified from the wild, and if you go in front of it, unfortunately, it will may be lethal. It is just like coming in front of a moving train. It would be 100% lethality. If you know the train kills 100%, so similarly, you know Nipah virus kills. You educate the workers there. They will not handle the raw sap. They will not drink it rather. And if they have to handle it, they will take protection. So we can control it 100% even without vaccines or even without it. But if there is a gain of function research, it would be unfortunate. So these are the references. Some of them, it's a review on Nipah virus. This is the natural history. Nipah virus multi-update scientific figures on ResearchGate. This is the cycle I had taken. WHO Nipah virus, Bangladesh, WHO statement on Bangladesh. Then Nipah virus outbreak India. This is the 2 cases to date, no deaths. And Hindustan Times, this is the one which is in the public domain about the clandestine research which was being conducted by a private lab in South India. So this is a dangerous thing. If a pandemic has to come, it would come from such misadventure, not from nature. This is the large stock, world's largest Nipah virus vaccine reserve is there. Coalition for Epidemic Preparedness and Innovation in collaboration with Serum Institute of India. They are having phase 2 trials are there, but one should question whether it is really a public health priority with so few cases and only if it is there, it has to be focused vaccination rather than mass vaccination. If there is not any tampering with the virus, so that's all. I think. I think I can stop sharing the screen and I can take some questions if there.
Thank you, sir. Thank you so much for your comprehensive talk. It was really very informative talk. And yes, we have received few questions from our participating doctors. So, with all your permission, I'm sharing my screen. I hope my screen is visible, sir.
This is highly transmissible. You see, this, as I said, I am more concerned about highly transmissible strain, mutant strain. You have used the word highly transmissible. If it is highly transmissible, it would be less lethal. So I am more concerned about the lab misadventure rather than nature. Nature, according to the Darwin's law of self-selection, any mutant strain which is highly lethal gets phased out. It dies with the victim. Only the lesser lethal strains are transmitted, and once it is less lethal, you have to see, as on today, there have been, for 30 years, it has not caused a wildfire. And once we have seen the graphs, the numbers of cases and deaths both are coming down. So why do you expect it will cause a wildfire? So we have to keep a watch. I mean, we have got, as I said, more pressing public health problems. Road traffic accident is just one of them. Daily, 1,500 people die from tuberculosis in India, three times more than the 30 years total deaths globally from Nipah. So 2,000 children die from malnutrition and infections. So there, we have got so many things on our hand. So definitely, if you have the proper health services, like this, two workers are healthcare workers, or hospitals, particularly, it was in a small place in West Bengal, private hospital without proper, perhaps, infection control and other things. So if you have a good public health infrastructure, we are prepared for any pandemic. If you are going for one at a time, piecemeal, that will only drain the resources without making an impact. Some other virus will come, again you will prepare vaccine with lot of investment for that. So in spite of that, if you improve the health access, quality health services all over the country, right from primary health center, district hospitals, and itself will give an early warning system by proper monitoring and surveillance for any unusual occurrences. I'm just forget, Nipah is just one virus and thousands of viruses may be there in nature. So global health system as on today is not prepared, I would say, for any pandemic. Only for Nipah will not prepare it for uh, any other virus. We have to be prepared for all viruses. Why only Nipah? Nipah is just one. As per the data, it is causing very little morbidity, mortality. Of course, the person who dies is very unfortunate. But when you are doing public health planning, you have to see which disease is killing the maximum. So the data for that, as on today, I am not worried. But if there is a gain of function research, I would be worried. So I have no answers if there is any human hazardous misadventures. And of course, for that also, you should have a good chain of public health infrastructure equitably distributed all over the country. That will solve all your future pandemic problems, not one virus at a time. Contact tracing is important in the very early stage because that is the time when you can contain it, you can quarantine the people. Once the virus or any pathogen has entered community transmission, with large number of asymptomatic cases, then contact tracing is not cost effective. It unnecessarily drains the resources. So definitely it is just like when you start a car, the first gear you have to put. The contact tracing is the first gear, because first gear consumes the maximum fuel and resource intensive. So contact tracing is at the start of an outbreak, and if you can contain it, then only it is useful. Once the outbreak is in the second or third gear, fourth gear, when it is running, it is for you can't run your car on first gear throughout your journey. So similarly, outbreak, if it gets prolonged, contact tracing can be counterproductive. Unnecessarily, it causes panic and it drains resources. But certainly, in the initial phase of a new emerging virus or new outbreak, it is important, but not in the as if it continues, which is the mistake they did during the past pandemic. They kept on tracing contact tracing when it was not subclinical infection outnumbered 30 times more than the cases who were symptomatic. So it is only in the first part of outbreak. So early diagnosis and detection challenges, I say the public health, as I said, I have been saying again and again, if we have the good health personnel, health resources, why we are resource limited? Because we are not concentrating on the rural areas, we are not concentrating on the marginalized areas. These emerging viruses will come from the marginalized, from the people, tribal areas who are working in the forest. If you have got good health system, why we should remain resource limited? We are resource saturated in the urban areas, in the metros. We have got the best medical tourism from all over the, attracting the best medical tourism uh, people who come for medical tourism from all over the world. We are resource rich, saturated, so we are unequally distributed. The challenge is inequitable distribution of the health resources. If we have equitable distribution, we will not miss early detection. Early detection need not have to be from the diagnostic lab. It can be from the clinical symptoms. It can be from the history. Yeah, people from the occupational history. If people going, say, if people going into some areas in forest, either monkeys are there, it can be cancer forest disease. So there is a high index of suspicion of KFD. If it is in the season, like this date palm is a season in the winter season, they collect the date palm juice to make that jaggery. So seasonal, so proper history taking, proper clinical examination, those skills are required. It cannot be always based on labs and which are very intensive, and which you have to like you hundreds and thousands you will spend and just detect one case. So it has to be resources, poor planning of public health infrastructure. That is the problem. Yeah, this is also important because this incubation period is like if they are having travel restriction and airport and all, it makes no sense because it doesn't. So this when you are doing this type of screening, fever screening at international borders, it should it makes no sense. And you have to, again, you go back to the epidemiology, you go back to the occupational history. Nipah virus, you know, it is transmitted by people who have come in contact with fruit bats or their droppings or their fruits. So you take the history. So incubation period can mislead you. He may be asymptomatic, but later he may fall sick. So if he is from that area, so that is more important. And then he can be outbreak containment may, he can be isolated for that period, 2 weeks or 3 weeks, whatever the incubation period, if given the occupational history or coming in contact with a person who has been diagnosed with Nipah virus or a health worker who has been attending to the Nipah virus. So that isolation can help once we know the incubation period. But the screening doesn't work because he may get sick afterwards. Thank you.
So these are the all questions which we have received from our participating doctors. Thank you so much for answering all the queries. And I would also like to thank all the participating doctors also. And I would like to request you all to follow us on our Facebook, Twitter, LinkedIn, and Instagram pages for more medical updates. Thank you so much, sir, once again for your valuable time and for being with us. So with this, we are concluding the session of our today. Thank
Thank
you, sir.
you, sister. Thank you. I'm logging off.
Sure. Thank you.